There are over 1 million total knee replacements done in the United States each year, and this number is expected to rise rapidly with the baby boomers aging. Pain and swelling are the most common complaints after a knee replacement. Swelling is normal after a knee replacement. The first week or so, the swelling can be more moderate to severe, and then over time this will gradually come down. But for some, this swelling can linger on for months to years later. How do we get rid of the swelling? Well, my name is Kelly and I am a physical therapist and I specialize in lymphedema and swelling. And I get a lot of referrals from surgeons and other therapists to try to help patients get their swelling down. So in this video, I'm going to share tips on how to reduce swelling after a knee replacement or after a knee surgery. Swelling is an accumulation of excess fluid in the knee joint. During surgery, the skin, the soft tissues, and the bones are cut. And after surgery, your body needs some time to heal. And so it's common to have more blood flow to this area for that healing for quite a while. We call this surgical swelling, and most of this will last for about 4 to 6 weeks. The patients may report swelling around the knee, above the knee, below the knee, and even into the lower leg and around the ankle area. Swelling may also be worse at the end of the day after someone has been active and after gravity has played a role. So first, the most basic way to reduce swelling is not going to be a big surprise to most people. It's elevating and icing. Icing an area is going to help restrict or narrow blood vessels in that region. So by narrowing the blood vessels, you're going to have less blood flow to that area, which will therefore reduce your amount of swelling. In a similar way, elevating the legs above the level of the heart is going to allow gravity to assist some of that fluid back to the body out from the leg. Another common and well-known way to get rid of some swelling is with movement. Ankle pumps, knee bends, leg raises, and walking can all help get some of the fluid moving. Your muscles act as a pump to your system, and so when you are active, your muscles are going to help your lymphatic system as well as your veins pump and push the fluid up and out of that area, and specifically from that knee. After surgery, many are resting and recovering, but doing no movement is going to cause more fluid to pool around the knee. And so by placing the leg up on a wedge pillow for some gravity assistance with elevation and doing some ankle pumps and some quad activation is going to be helpful. While those are the most basic ways to reduce swelling, what happens when the swelling won't go down at an expected rate? As a lymphedema therapist, I commonly see individuals have a flare-up of lymphedema or venous insufficiency. A lot of these individuals will have an underlying dysfunction of their veins, of their lymphatic system that gets exacerbated by a surgery like this. So in therapy, we need to go to compression. The first line of treatment for someone who has mild to moderate swelling after a surgery like this is something like a compression stocking or something like a VELCRO wrap. A compression stocking comes in a couple different options. This is a knee high, so most commonly people will have some sort of compression on their lower leg if they have swelling, or there also are options for thigh high that go above the knee. There are off-the-shelf options that someone can get in the store or online, and I will place some links down below for different options, but I usually like the ones that have the silicone band at the top because they stay up a little bit better. And we're always looking for a medical grade compression, which is 20 to 30 millimeters of mercury of pressure, and it goes up from there based on what someone's individual needs are. One thing we have to do is make sure that someone has the correct size and they fit properly. If someone gets one that is too small or too tight, they're at risk of getting a tourniquet, which is where the compression stocking will dig into the skin, and that can actually worsen the swelling or cause some skin breakdown. So working with a lymphedema therapist in someone's area is going to be the best way to make sure that someone is getting the right fit. For someone who has a different anatomical shape or they just need more compression for more severe swelling, they may need to look at getting a customized flat knit garment, which is just a thicker fabric that is more inelastic for better containment of that swelling. If someone struggles to get them on and off, there are various options of donning aids, such as this one right here, or they can have donning gloves that help grip and pull the stockings on a lot easier. After surgery, someone is likely to have less range of motion at their knee to bend over to get the stockings on and off, and so these kind of tools are going to be really helpful. These type of donning aids, what we'll do is take the stocking and roll it over the top and guide it down all the way. And then someone can put it on the ground, or they can have one that has the long handles on it, and they can stick their foot inside and then pull the donning aid up to get the stocking on easily. I will link some of my favorite types of donning aids down below as well that you can check out. Now, if someone has more moderate to severe swelling that won't go away with a compression stocking, usually we have to go through what we call complete decongestive therapy first. And so as a lymphedema therapist, what we do is use short stretch bandages such as these. They look like an ACE bandage, but they are different. These have a different woven stretch to them that are meant for swelling. Actually, an ACE bandage is not going to be very effective. And so we use the short stretch bandages with various types of foams and paddings to help support the skin, and we'll bandage the leg, usually below the knee, sometimes above the knee, depending on what's needed and how long after surgery. And this works like a charm to help reduce the volume and the swelling. Sometimes it takes 2 to 3 days, sometimes it takes 2 to 3 weeks. It just depends on the severity of it. But this is what we use to help reduce all the swelling. And then once someone's swelling is down, then we will go back and get them the correctly fitted compression stocking to help maintain that reduction. Sometimes when the swelling is severe, compression stockings are not enough to reduce all of the swelling. They will reduce a little bit, but if someone has a lot, they're not going to be effective on their own. So we do the complete decongestive with the bandaging, and then we will go back into the stocking for the compression. We will also use what we call manual lymphatic drainage, or also known as lymphatic drainage massage, to help guide the fluid out of the area. This is usually done lying down with the leg elevated so gravity can assist, and this is something that someone can do on their own at home as well. As a therapist, we usually spend anywhere from 5 minutes to 25 minutes working the fluid out of the area, and then we'll put someone back in compression. Like I mentioned before, this can also be done at home on your own, but you want to make sure that you're cleared from your surgeon or your doctor first. I have created a lot of other videos on lymphatic drainage massage and the sequencing to go through, and I will just place links for those videos down below. Lastly, but also most importantly, not all swelling is normal. If someone has rapid swelling with redness, pain, and even flu-like symptoms, these can be signs of infection or even a blood clot. These are really serious conditions that someone needs to get emergent medical attention for. And when in doubt, it's always best to go get checked out and cleared. So those are the main ways to reduce swelling after a total knee replacement, both short-term and long-term. For more videos related to this topic, be sure to subscribe down below, and I'll see you all next week for another video. Thanks everyone.